Hey there, it's Dr. Hart again. This is Nursing with Hart, PhD, and I have some questions for you on substance use disorders. These are a very important part of your study of the concepts of mental health nursing. Okay, so let's get started. On the first day of a client's alcohol detoxification, which nursing intervention is the priority? So this is a priority question. Number 1, encourage the client to attend 90 Alcoholics Anonymous AA meetings in 90 days. 2, educate the client about the biopsychosocial consequences of alcohol abuse. 3, administer ordered chlordioxepide, Librium, in a dosage per protocol. Or 4, administer vitamin D to prevent Wernicke-Korsakoff syndrome. Okay, we'll give you a minute to think about this, and then we'll come back. Okay, let's come back to this question. And the correct answer on this one is 3. Administer ordered chlordioxepide, brand name Librium, in a dosage per protocol. So let's talk about this for a minute. So chlordioxepide, or brand name Librium, is a benzodiazepine that is used to prevent seizures, to keep the patient safe when they're going through alcohol withdrawal. So you have to know the difference between withdrawal and intoxication. Okay, there are different interventions, different concerns for safety. With alcohol withdrawal, your patient their brain has been rested or relaxed with the use of alcohol. The alcohol is a CNS depressant, so it has been depressing the brain while they are drinking alcohol. When the alcohol is removed from the picture, the brain, having been relaxed, is now excited from losing that relaxation from the alcohol. So now the brain is overstimulated. Okay, and so this puts your patient at a high risk for seizures. If this is not treated, there can be more serious, very serious seizures, delirium tremens, which is a very serious seizure disorder from the alcohol withdrawal, and even death can happen if this patient doesn't receive immediate treatment. Okay? So the correct answer is 3, administer the ordered Librium, which is a benzodiazepine. Benzodiazepine is a CNS depressant. It will bring the brain back down to relaxation, will prevent seizures, keep your patient safe while they're going through the alcohol withdrawal. Very important. So let's look at these other answer choices now. We're thinking of priority, life or death. What's going to keep the patient alive and what is not. Okay, so number 1, encourage the client to attend 90 Alcoholics Anonymous AA meetings in 90 days. Yes, that is a typical recommendation for patients recovering from alcohol. In their first 90 days, studies have shown if they attend 90 meetings in 90 days, their chances of staying sober, staying in the program, staying in recovery are much greater the more meetings they attend after they detox. But attending meetings at this point in this situation, when they're going through withdrawal, is not the priority. Okay, number 2, educate the client about the biopsychosocial consequences of alcohol abuse. Again, it is important to educate your client. But again, this is not the priority when your client is going through withdrawal. Number 1, they're going to be shaking, agitated, anxious, blood pressure is going to be sky high, they're not going to be able to even listen to you. They're going to be so shaky and so anxious. They are not going to be able to concentrate on anything you're saying at this point. Okay? And then number 4, administer vitamin 1 to prevent the Wernicke-Korsakoffs. So that is important, but of these choices, the benzodiazepine is most important. The Wernicke-Korsakoffs is caused by a vitamin B1 or thiamine deficiency from the chronic alcohol use and abuse. The Wernicke-Korsakoffs can cause paralysis of the eye muscles, double vision, ataxia, trouble walking, sleepiness, stupor. If there is not a thiamine replacement very soon, the client can have serious consequences. And this is the Korsakoffs. Part of that is the psychosis, loss of memory, confabulation, which is the alcoholic who is making up words when they can't think of what to say. They're confabulating their own words. And there is, together, it's Wernicke-Korsakoffs, those two things together, okay? And that is treated with oral or parenteral injection, parenteral injection in the deltoid muscle or the hip muscle, okay? The injections, of course, work faster, so that's mostly, in my experience, what was given is the injection. And then once the injection is given, then typically while they're in detox treatment, they will be given oral thiamine. Okay, let's look at the next one. A client with a history of heavy alcohol use is brought to an emergency department by family members who state that the client has had nothing to drink in the past 24 hours. Which client symptom should the nurse immediately report to the ED physician? Okay, another priority question for you. Number 1, antecubital bruising. Number 2, blood pressure of 180/100. Number 3, mood rating 2 out of 10, or dehydration. So think of the priorities, and we'll come back to this question. Okay, let's come back to this question. So we're talking about alcohol withdrawal. Again, history of heavy alcohol use brought into the emergency room. Family members are telling you the client hasn't had anything to drink in the last 24 hours. So we're talking about immediate needs for this client who is going to begin to go through serious withdrawal symptoms. These withdrawal symptoms can begin within 48 to 72 hours after the last drink of alcohol. Okay, so the answer on this one is number 2. Number 2 is the priority. Look at that blood pressure of 180/100. Very serious. Okay, so this must be immediately reported to the ED physician. High blood pressure and other complications associated with withdrawal can start, and they may even progress to delirium tremens and seizures, okay, within the 48 to 72 hour period after the last drink of alcohol. Let's look at the other answer choices. Antecubital bruising, yes, it is something that's going to happen with chronic alcohol use and abuse, but that's not the priority. Number 3, mood rating 2 out of 10 is not the priority. And then 4, dehydration may be looked at after the emergency situation is taken care of. So always think of your ABCs, airway, breathing, circulation. Think about Maslow's hierarchy of needs, and think about the nursing process when you're answering these questions. All right, next one. The nurse holds the hand of a client who is withdrawing from alcohol. What is the nurse's rationale for this intervention? Number one, to assess for emotional strength and regret. Number two, to assess for Wernicke-Korsakoff syndrome. Number three, to assess for tachycardia. Or four, to assess for fine tremors. All right, we'll give you a minute and we'll come back. Okay, let's come back to this test question. Okay, so the nurse is holding the hand of a client withdrawing from alcohol. What's the rationale for this intervention? Okay, and the correct answer is number four. The nurse is assessing for fine tremors. There can also be gross tremors, which are worse. I've had patients in the centers I've worked at, they're literally, their hands are shaking so bad that in order for them to take a drink of water with their medications, you have to literally hold the cup for them because they cannot even balance the cup. That's how much they are shaking from the withdrawals. Okay, so that's why the nurse is holding the client's hand to assess for fine tremors. Let's look at these other answer choices. To assess, number one, to assess for emotional strength and regret. Okay, that is not why the nurse is holding the client's hand. Number two, to assess for Wernicke-Korsakoff. I talked about Wernicke-Korsakoff in the previous question. Wernicke-Korsakoff is the lack of vitamin B1 or thiamine, and that is caused by the lack of absorption. The body is not, when the client is drinking heavily, the stomach is not absorbing the thiamine, so there's a thiamine deficiency that can be very serious with the confusion, the delirium tremens, and everything else that I talked about before. Okay, you're not assessing for tachycardia either. Okay, in this one, some of the other symptoms of alcohol withdrawal can be headache, insomnia, tachycardia, depression, anxiety, agitation, sweating. Okay, and also the coarse tremors. Okay, someone who's been drinking for a long period of time is, once the alcohol stops and once they stop drinking, they are not going to be able to sleep. They are used to, with chronic alcohol use, they are used to passing out. They're not used to going to sleep on their own, so that's why they are going to be suffering from insomnia. Okay, let's try the next one. Upon admission for symptoms of alcohol withdrawal, you see a trend here, right? With the alcohol withdrawal. Client states, I haven't eaten in 3 days. Assessment reveals blood pressure of 170/100, pulse of 110, respirations of 28, breaths per minute, and a temperature of 97 degrees Fahrenheit with dry skin, dry mucous membranes, and poor skin turgor. Which of the following is the priority nursing diagnosis? Now, I know that you're hearing, and it is true, that the NCLEX is not concentrating as much on the nursing diagnosis. So you may not see any questions directly asking you for the nursing diagnosis on a certain set of symptoms like this. But I thought this question was important too. Also, just it's teaching you something else, and we'll talk about that. So your choices are 1, knowledge deficit; 2, denial; 3, deficient fluid volume, deficient fluid volume; and 4, ineffective individual coping. So we'll give you a minute and we'll come back and talk about it. Okay, let's come back. And the correct answer is number 3, deficient fluid volume. And the reason I picked this was it's good for you to know the signs and symptoms of deficient fluid volume. And I have talked about other practice questions that have these symptoms in there. You must know in your fluid and electrolytes content, which is covered in the NCLEX and in your school, you must know the signs and symptoms of deficient fluid volume. Okay, and these are the symptoms. They are dry skin, dry mucous membranes, poor skin turgor, elevated blood pressure, and heart rate. Okay, let's look at the other answer choices. Number 2 is denial. That's not denial that they're describing. Oh, number 1, knowledge deficits, not the priority. Nursing diagnosis. 2 is denial, not the priority. And 4, ineffective individual coping. Okay, so if you're looking at an ABC priority also in these answer choices, if you're going to pick, you can see where there are serious signs and symptoms that your patient is demonstrating to you. So if you're looking at these answer choices, which one follows the ABCs and which one would be priority? Okay, it's not knowledge deficit, it's not denial or ineffective coping. The physiological priority here is deficient fluid volume, okay? And so the deficient fluid volume is caused by the decrease in fluid volume during alcohol withdrawal and the decrease in proper fluid intake. Your client has been using and abusing alcohol for a number of years or a period of time. They are not drinking water, they're drinking alcohol. Okay, so that's where the fluid deficiency comes in. All right, I think I have one more. Which medication orders should the nurse anticipate for a client who has a history of complicated withdrawal from benzodiazepines? Okay, so number 1, haloperidol or Haldol and fluoxetine Prozac. Number 2, carbamazine. Sorry, I have trouble in pronouncing some of these. Tegretol and danazepam Aricept. Number 3, disulfiram, brand name Entebuse, and lorazepam, which is Ativan. Number 4, chlordiazepipe, Librium, and phentoin, which is Dilantin. All right, we'll give you a minute on this one. These are the medications to treat benzodiazepine withdrawal. Okay, let's come back. All right, and the correct answer is number 4, the chlordiazepipe, Librium, and the phentoin, which is Dilantin. You have to know these medications. You have to know what they're for, the drug class, what they're used for, and in order to answer this question, obviously. So someone who is withdrawing from benzodiazepines is treated very similarly as it is treated for alcohol withdrawal. Benzodiazepines also is a CNS depressant, depresses the brain. So what happens when the benzodiazepines are taken away? This is someone who has chronically used benzodiazepines, and then they stop taking those. Withdrawal starts. The brain is excited now. The benzos are taken away. The brain is excited. Okay, seizures can begin and death can happen from this very serious situation with the benzo withdrawal. The medications are number 4 that the nurse would anticipate. Okay, the chlordiazepipe Librium is another benzodiazepine. So that's what is used to treat the withdrawal. so that will get the withdrawal to stop. The difference is if your patient is in a detox substance abuse treatment center, they are only going to be given the Librium for a short period of time, say a 7 or 10 day detox protocol, and then they are going to be tapered off of the Librium. So the Librium is used for benzo withdrawal, and also the phenytoin dilantin is an anticonvulsant. Okay, and that will help prevent the client from having those serious seizures that will come from the benzo withdrawal. Okay, let's look at the other answer choices. Number 1, haloperidol or Haldol, and fluoxetine. So haloperidol is a typical first-line, first-generation antipsychotic. Okay, very strong. Lots of side effects from that. Fluoxetine is an SSRI, Prozac, SSRI, selective serotonin reuptake inhibitor. That's an antidepressant. Okay, number 2, carbamazine or Tegretol. Okay, that is a used to treat seizures and nerve pain. But you have to look at the other one, Dinazepam or Aricept. That's used for Alzheimer's. Okay, for the confusion, memory loss, dementia. That's linked to moderate, mild, and severe Alzheimer's. So it wouldn't be that one. Okay, number 3, disulfiram or Antabuse is an alcohol deterrent used for alcohol abuse. This is taken by the patient, and if the patient drinks alcohol while they're taking the Antabuse, they will have serious side effects, flushing, severe headache, and it will be very uncomfortable for them. So it's deterring them, hopefully, from drinking. Lorazepam or Ativan is another benzodiazepine, okay? But combine that with Antabuse, it's not the right answer. Okay, so I covered haloperidol, Tegretol, Antabuse. I covered all of those. Okay, so those are a lot of medications. There are a lot of medications that you need to learn for not only your pharmacology, but for your mental health disorders. There are medications that are used, and I will have more test practice for you on the substance use disorders. The reason you're going to see more content, more questions on alcohol abuse is most likely there are a lot of questions on opiate use and abuse also. But those are the two, alcohol and opiate abuse, are the two main most common substance use disorders in our country. So those are the cases that you are going to see in your practice, and you are going to see alcohol abusers and opiate users in the emergency room, not just in a treatment center. You will see them in the emergency room. You will see them in maternity and OB, having babies. You will see them in a med-surg floor or unit. You will see them in the acute care units, definitely. Okay, so my point is, you're not going to just see them if you go into mental health nursing. Yes, you will see them. Those will be all your patients. But you're going to see people suffering from these substance use disorders in all areas of the hospital. Okay? All right. So I hope you enjoyed this and got something out of it. That was a quick one, but I will have more, I promise. And if you're enjoying getting something out of it, please like, share, and subscribe to Nursing with Hart, PhD. We'll see you on the next one. Have a great day.